This is Debbie Bucher for the LPN to RN Transitions course, Nursing 210 here at Parkland College. This is Chapter 3, talking about study habits and test-taking skills. So classroom study habits that seem to work is, first of all, some people feel more comfortable with face-to-face classroom structure, and some people find it very comfortable to do something online that you can do, at your home or wherever really that you have access to a computer. So at any rate, no matter what structure that you're learning from, you want to practice, of course, effective listening. And also prior to class, it's important to read the material and review notes that you may have taken while you were reading the material, and maybe jot down the main notes before class about the material, and maybe write down any questions that you might have when you see your instructor that you need to maybe understand better or more clearer. And it is important that you do effective note taking, again, whether you're doing a class like online now or whether you're taking a face-to-face course like the Med-Surg course or 151, the mental health course. It's good to take down notes. You don't want to write down everything, of course, that the instructor says, but if the instructor makes a point to say, I want to make sure that you know this, or make sure you know this, you might see a question about it later on a quiz or a test or something. So when you hear something like that, you want to kind of hone in and write down whatever point it is that they're making, so that you can make sure that you go back and look at and make sure you have a good understanding of it in case it does show up on a quiz or a test, later on down the road maybe. And of course, you want to be active in your learning. The more active you are in your learning and the different ways you experience it, you read the book, you're listening to the audio recordings for this class. There's maybe other audio recordings you can listen for other classes and answer questions that are in the book, and maybe work with another person. But the more ways you get into the material, then the more I think that you can learn. So, and again, making sure that you're being an active participant, adding to the discussions when it's face-to-face, or when we have discussions online, making sure that you're being active in the discussions that are online, which we will be having most weeks. So it's been shown, actually, in research that shows actually the more active you are in your learning, actually the more you learn, and I think the more successful you can be. So again, read the material before the class, jot down areas that you maybe feel need to be cleared up during class, or maybe email your instructor to ask questions. And then after class, I would add to your notes and maybe rewrite them. It also shows that if you write your notes, that you will learn more versus if you just type them on a computer. Many of you have computers that you do that with, which is fine, but research has shown that actually if you write down your notes, that you actually learn more, which is good. And of course, when you're sitting down to read your books and you read the material, make sure that you're putting your phone away. Maybe do it at a time where you know that you won't be interrupted, maybe after your kids go to bed or maybe after they go to school. Just try not to get distracted, and stay with either the reading, or if you're doing a discussion, that sort of thing. And again, making sure you're doing different ways when you're learning, such as reading the material, listening to it, answering the questions that are in the book, answering NCLEX questions that may be from Kaplan or from other NCLEX review books, I think is also very helpful. And success in online courses, of course, which is what this is, or it's a hybrid course. Your lecture is online. You can listen to it, anytime, anywhere that you would like. I am recording the PowerPoint along with it, so you can always take notes as well. Again, you want to either way, either whether it's a face-to-face class or an online class, you always need to create a schedule and try to stick with it so you can be successful. It's always good to make a list of your assignments with due dates, and you might even want to maybe put due dates actually earlier than what is required to make sure that you do get them in on time. And particularly online courses, you really need to be self-disciplined and have good time management skills, because there's not going to be, you don't meet on Mondays at 2 o'clock for lecture like you do your face-to-face courses. You're on your own. You need to get into your book and read the book, but as well as listen to the lectures and see. You can view the PowerPoint as well and take notes as along the way. But you do need to make sure that you are using good self-discipline and time management skills to make sure that you're sitting down and doing it for an online course just like you would a face-to-face course. And of course, getting organized is pretty crucial. And again, we'll be having discussions online, making sure that you answer those discussions the way I've asked you to, and also that you get back to other people in your discussions and make sure you get your discussions done and completed in a timely manner of which I have given you the due dates for. So you really need to be self-motivated to be successful in an online course. And you probably already have online courses. I think online courses are really nice. I mean, again, you can get as much out of them, if not even more sometimes. But again, I think though, as long as you stay on top of it and making sure you're doing your readings and listening to the lectures, you should be successful. And online courses, I think are a really nice way to offer people material, because you can do it, more on your own time, when you want to do it, which I think is nice and makes it flexible for you. So effective reading, again, you want to make sure you can identify what the main ideas are, and if you think you know it, just don't skim over it. Go ahead and read the material. It's always good to go over it again. And also to make sure that you are able to concentrate. So try again to do without distractions, and that you're writing down questions as you go along and answering questions as you go along as well. And again, if you're not sure about something, make sure you get into maybe the topic in your book a little bit further if you're not understanding it, or emailing your instructor or asking questions in class if you're not quite sure that you understand what the main idea is or what the main idea is about. Highlighting is okay. You want to be careful. It seems like when I see people highlighting, they highlight everything, so it really doesn't do people, I don't think, a whole lot of good to highlight. And it's really only, as you can see, only appropriate to highlight no more than 20% of the material that you're going over, because if you're highlighting everything, then you might as well not even highlight them. So again, even if you just skim through, even if you don't have time to like sit down and read it, but even if you skim through it, take a look at the main topics and look into the ones that you maybe don't feel that you understand, as well. Honing in on those areas will certainly help prior to you going to lecture. Skimming can help you pick up on the main points, and also kind of helps you with your retention as well. And of course, it's the textbooks that we use. It seems like they're all usually pretty large and have a lot of pages, so it is kind of hard to, I know, keep up with the readings. But if you can, we certainly can't talk about everything that is in the text, but there are a lot of good things that are in the textbook. So if you can try to allow yourself enough time to read what's in the textbook readings, I think it will help you, and it's another way, of course, that you can learn. So, and again, yeah, you want to be able to differentiate between major details and minor details, of course, and not highlighting everything, but just 20%. And again, if skimming kind of helps you beforehand, kind of highlight the areas where you feel like you need to delve in a little bit deeper, that's also a good idea, of course. And then there's acronym SQRRR, improving your study skills. And step one is survey, which is where you're, again, kind of like what I talked about just a minute ago about skimming the reading, skimming the book. And really for about every hour class, this is a 2 credit hour course. Actually, it's a 5 credit hour course. 2 credit hours are lecture, and then you have 3 hours of lab. So usually you're spending, for every hour of class, you should probably plan on spending another 2 to 3 hours studying and doing the readings. And it is easier sometimes to break up your study sessions into maybe 3 20-minute sessions versus a 60-minute session. Allows you to get up, you move around, get something to drink or eat, and maybe be able to help you focus and concentrate a little bit more. But again, in the acronym here, S is survey. Step 2 is question. So write down your questions or email your instructor with questions. Step 3 is actually doing the reading. Step 4 is reciting or talking about the material out loud, or maybe you're even talking to somebody else about the material, what you've read and what you understand. And step 5 is in, of course, reviewing immediately after you get done with class or after you get done listening with lecture, and maybe taking down more notes or organizing your notes, or maybe changing something about your notes, something that maybe you understand better after the lecture now. So those skills should help you improve your study skills and how much that you're learning. And again, just don't try to overwhelm yourself. Take breaks. That usually helps. And then, of course, not only do you need to be good learners, be good active learners, so you learn more. There are test taking skills that should help you as well. Of course, there's multiple choice questions, which I'd say probably most of the questions I have in my med-surg course as well as in this course are multiple choice questions. You can also have true false and matching. I don't think I have any true false questions. There might be a matching question here or there, or maybe an ordering question, like what do you do first, what do you do second, that sort of thing. There's also essay questions, which I think are good too. I don't generally have essay questions though. So there's also, besides multiple choice questions, there's also the select all that apply questions, which many of you probably had several of those when you did your LPN NCLEX. Seems like we're seeing more and more of the select all that apply questions on NCLEX, or at least that's what we hear anyway. So, which those of course are harder, but yet we want to try to get you ready for taking NCLEX. So, and when you're looking at those select all the apply questions, just kind of make sure you're going through and looking at all the answers and just kind of saying, okay, according to this subject area and what they're asking, is this distractor, true or false? If it's false, then I probably wouldn't be checking that as my answer. I would just be checking the ones that I feel are true. So, and of course, again, you want to make sure you read the question entirely, read all the answers. You need to figure out what the question is asking you and then the best answer for that question. You may like all 4 answers, but what is the best answer for that particular patient and the situation? So, which is a lot of what, the NCLEX questions are, of course. So, and there also can be completion or fill in the blank questions or short answer questions. Again, I don't generally have that type, but you may see those in other classes. And then universal advice for optimal test performance is really just getting plenty of rest so that your body and mind are working well, and you feel prepared and rested, and you want to prepare the night before class and arrive at class early before you get there for the exam. Maybe just kind of relax a little bit before you go into class, or maybe relax a little bit before you start listening online. And while you're taking the test, you want to again determine what that question is asking you, and then make sure you look at all the answers and make sure you understand all the answers. And usually people will come in and tell me that they missed a question, but they had the right answer first. I would say probably 99% of the people that come in and talk to me about their quizzes and tests tell me that they had the right answer first and they went ahead and changed it. And what I tell people is only change your answer if you feel like you have kind of irrefutable evidence to change your answer. Otherwise, if you don't feel like you have that light bulb moment, I wouldn't change the answer, because like I said, most people their gut instinct is usually right. So trust your gut instinct. So yeah, so plenty of rest, well-balanced diet. Just make sure you're ready to go, be on time. Just try to take some deep breaths before you take the quiz or test. And again, make sure that you're, taking your time, answering every question. And if you get stuck on a question, then go on and maybe answering another question will help you answer the question that you're having trouble with. But don't just sit there for minutes, struggling with a question, because that's just going to make your anxiety worse, actually. So it's a question here. A licensed LPN nurse is taking a multiple choice test and reads the following. The nurse is about to begin a sterile dressing change with a patient. The patient has an infected wound. The patient has family in the room. The first three actions the nurse would take in order are. So which part of the question is the stem? So your stem is the question. So the nurse is about to begin a sterile dressing change with the patient. And again, the patient has an infected wound. And then so what part of the question is the stem? Again, is answer number one, is again the first three actions the nurse would take in order are. So yeah, so the first three actions the nurse would take in order are. Okay. So again, the stem is the question that it's asking. So again, the stem in this question is the first three actions the nurse would take in order are, and then you would list out those list out those actions. And again, the stem is part of the item that either asks the question or presents the problem and any conditions that apply. It can be in the form of a complete or incomplete sentence, and it could be formatted in a positive way or a negative way. And again, it can maybe be, it may ask you to prioritize. So maybe you're prioritizing different steps. So you want to make sure that you understand the stem, you understand what the question is asking you and what the situation is. And then your distractors then are you have your answer, and then the other ones that may be pretty close to the answer or could be the answer, but you have to stop and pick out the best answer for that particular question, which can get kind of tricky sometimes. But anyway, so yeah, so being prepared for testing, taking good study habits and good test taking skills is important. Really, no matter what class that you're taking. So this concludes the lecture for Chapter 3 in the LPN to RN Transitions book on study habits and test taking skills.